Good morning, everyone. The topic today I want to talk to you about is about X-rays or radiographs, or mainly OPG or orthopantograms or panoramic radiographs, as it's called in different areas. Um, there is a very interesting story. I had an associate probably around last year, or maybe the year before, started with us in the practice, and as a record for most new patients, we take full photos, we take bitewings with full OPGs or panoramic X-rays. And for some reasons, I noticed that associate wasn't keen or didn't take much OPG X-rays. So I thought I would have the discussion with him and understand why the reasons are. And before I get into it, again, for credibility, my name is Khaled. I have been a general dentist for 20 years in Hervey Bay, Queensland, Australia. I own and run my own dental practice, Lakeside Dental Spa, and I own this practice for 14 years. I took it from 1 chair to 10 chairs, from a staff member or team of 3 staff members into a team of 40 at the moment. So one of the things that I heard during the discussion was there was some reluctancy to order this X-ray for patients, because there was some concerns about the amount of radiation being exposed, the risks exposed, and he recently attended a training course on radiographs or extraoral radiography course, and the radiographer made it clear during the course you should be very, very cautious before ordering an OPG and have clear indication for ordering. And he was kind of like concerned about over requesting this request. This discussion was very interesting because from a clinical perspective, you have to weigh between risks and benefits. So there are risks of taking radiographs and there are benefits. And there are also risks of not taking radiographs, and there's also benefits of not taking radiographs. But when I put the risks and benefits on a scale in a private practice, and I've been treating patients for many years, the risk of not taking an OPG or an orthopantogram for a patient, especially if they haven't had one for at least 5 years, outweighs the benefit for not taking them. Excluding all medical issues on side, so patient had radiation recently, I'm just talking about healthy patient. Most of the time, if you're relying on your clinical exam and your bite wings, maybe some PAs, you could be missing a cyst around a wisdom tooth. You could be missing a cyst under a root canal treatment, tumors. I mean, the list goes on, impacted teeth with some cystic changes. Sometimes you can even miss some early onset of perio in some cases as well. I cannot understand how you will have a new patient that you haven't seen before, and just doing clinical exam and taking bite wings is enough to tell your patients everything is 100% perfect. There are numerous cases I've seen where I have patients who are reluctant to take an OPG. I put the risks and benefits on a table for them, and I took the OPG. There is one particular patient under his central incisor, there's a big cystic lesion that has to be referred to a maxillofacial surgeon and endodontist as a team to manage that. Another patient had a big dentigerous cyst around one of the molars on the lower side. Another patient had a tumor in his maxillary sinus that was managed by an ENT. All those pathological conditions were never picked up by the previous dentist simply because they were reluctant to order an OPG. The other thing as well, children between 7 and 10, if you order an OPG routinely for children at that age, after you palpate the canine and you cannot feel the canine eminence or where the canines are, you can easily, by measuring the lateral incisor long axis and the long axis of the canine, you can, and there are studies, I can share it with you, you can predict the risk of impacted canines. And if you see the canine in a certain angle compared to the lateral, you can decide early on whether to extract the deciduous canines or whether you even need expansion as well. And you can see that sometimes the canines, permanent canines, correcting themselves into position. So if you don't routinely palpate the canines and take an OPG, if you can't find them, you are depriving your patient from a great value of being a great diagnostician, because they are coming to you, paying you their hard-earned money and income for you to give them a proper diagnosis and a full diagnostic figure. So for me, it's a very important, I would say 99.9% of patients excluding again medical conditions, even if they are edentulous, I think OPG or an orthopantogram is essential. And there were cases medico-legally where patients were, where the dentist was liable for misdiagnosis because they haven't ordered a full mouth PAs or a full mouth OPG. You can, if you search for those cases, you can find them, where the dental board considered the dentist was underperforming by missing certain periodontal conditions because they haven't ordered a full mouth PA or a full OPG. So I hope you find this information valuable. If you have any questions, please ask in the comment. Please like and share this with your friends and colleagues. And if you find this information helpful, please make sure you subscribe to the channel so I can provide you with more information. Thank you so much for listening to me today. That means a lot to me.